I have a special panelist with me tonight. And this person wrote an article that this sort of knocked my socks off. I was reading it, and she does this on a regular basis, by the way. But this is Julie Rovner. She is the KFF Health News Chief Washington Correspondent, and is really on top of things that are going on in the federal government. One of the greatest sources. I read her columns all the time. So she's on my speed dial as far as my reads for the day. But we're going to have a discussion about the article that Stephanie Amor and Julie Moore, and it's Trump's picks for top health jobs, not just team of rivals, but team of opponents. I thought it was really interesting, the terminology that was used there. But Julie, why don't you tell us more about this? I have some specific questions, but you can tell us more about your article and why you thought it was so important to write it.
Well, first of all, we don't know whether any of these people are going to be confirmed yet to the jobs that they have been named to by President-elect Trump. But what we do know is that if they do end up in these jobs, and these are the biggest jobs at the Department of Health and Human Services, obviously starting with the secretary, but also, the people who are going to be in charge of the Food and Drug Administration and the National Institutes of Health and the Centers for Medicare and Medicaid Services. They all have very diverse views, in many cases diverse from each other. So they don't necessarily agree with each other or necessarily with the president-elect, or, it could devolve into quite the food fight amongst them and between them. And it might interfere with their ability to do some of the things that they anticipate doing, or some of the things that the president-elect anticipates them doing.
Yes. Yeah, because I was looking at some of the people that you mentioned in there. Dave Weldon for the CDC, and Marty Makary for the FDA, and then Jay Bhattacharya for the NIH. Yeah, Bhattacharya. Yeah, and I'm wondering, it sounds like some of them have some expertise, that they can actually lend to the agencies, but the overall prevailing feeling seems to be that it's always top down. And one of the things that was mentioned is the fear that may be generated in some of them by one of their colleagues, was saying that you always speak to your boss, and your boss, to their needs or what their directives are, and that's really kind of a scary kind of thing. Especially when we start talking about topics such as abortion or vaccines, and just general health care, which it should be left to the experts. But you were mentioning also that people are sort of bucking the system of expertise, right? And so maybe you can talk about that a little bit more. What is that all about?
Yeah, it's not a good time for to be an expert in Washington. There's a lot of people who really believe that people should make their own decisions about their health care. And sort of the more expertise you have, the less likely you are to be trusted. And so we have a lot of people, coming in. Jay Bhattacharya, who would be the head of the NIH, was one of the people who wrote the Great Barrington Declaration, which was the treatise that recommended that basically COVID be allowed to just run wild and burn through the population, and that we would try to protect the people most at risk, the elderly and those with, compromised immune systems. And then, everybody else could get sick and get over it, and we could go back to normal. And that was highly controversial, and basically disputed by much of mainstream medicine, if you will, including some of the other people who have been named to some of these positions. You have people like Dr. Oz, who was, a TV doctor, also a cardiac thoracic surgeon. I mean, he's definitely a doctor, but he has no experience with Medicare or Medicaid or the Affordable Care Act, and yet that's what he would be put in charge of. That was a very curious choice to a lot of people.
Yeah.
We haven't we will first get confirmation hearings for the secretaries. So we'll see a confirmation hearing at some point for Robert F. Kennedy Jr. We won't get confirmation hearings for these second tier people probably until February. And then I think we'll learn a lot more about what it is that they think. But meanwhile, we don't necessarily know what President-elect Trump thinks about some of these issues. He's changed his mind on so many health issues over the years. We know he is not exactly an expert on this, nor is it really at the top of his action agenda the way healthcare and immigration are.
Yes. And then, it's a pick for, the Surgeon General, Ashwik Watt. And I was wondering more about, her background. I actually did took a liberty, and I started looking in the side of, the Wikipedia and that kind of thing. And she had a tragic history. I mean, she was trained in the islands for her MD degree, but she actually had an unfortunate incident where her father was killed by a gun when she was fishing. The tackle box fell over, and it was an accidental shooting, ending in her father's death, which is a horrible thing for anyone to go through. But I'm trying to, one of the things she said was that, the vaccines were a gift from God. And when she was referencing COVID-19 vaccines, and that was during the Trump administration, he had, Operation Warp Speed and that kind of thing. And, actually that did probably save quite a few lives, around the nation. And so, I'm trying to figure out whether the picks that he has are really matched to the positions that he's trying to put them into. And that's really where the big issue is really coming in with me. And from one of the things I'm fearful of is that if you're not really that well matched, you're fearful for your job all the time, and you may bend your will a little bit. In the direction of what someone is saying, whether you think it's good or not.
Well, sometimes if you're not well matched for your job, you end up basically doing what the
So,
career staff tell you, but that doesn't seem to be what this administration is all about. This administration is about not listening to career staff. In fact, in some
right.
cases, pushing out the career staff. These are career people who've been there through Democratic and Republican administrations, who are expert at their jobs and who do know how to do them. So, the one thing that all of these people have in common, and I can't remember whether this was in the story or not, is that they're all basically good on TV. I mean, that's something that's really important to President-elect Trump, and he says it. He admits this. He wants people who will be good spokespeople, who are, and they've all been Fox contributors at some point, because that's what Trump watches, and that's basically where they've all come from. Is their expertise necessarily well matched to the jobs they've been named to? I could see how you could move some of them around and they would be better matched to other things. But it's not my administration. So we'll basically wait and see, all of these positions, even these, under the secretary positions, are subject to Senate confirmation, including for the first time this year, the director of the CDC, which used to be just someone who would be appointed by the president and the secretary of HHS. But now the Senate gets to pass on that person too.
Yes.
So all of these people, including the nominee for Surgeon General, will come up before the Senate for hearings and votes.
One of the fears too is that when you're in an environment like that, you can end up having a lot of misinformation or disinformation that is created. These myths are created and propagated and amplified by sometimes misguided or charlatan scientists. So, as far as things like, Leo Kanner and Bruno Bettelheim, they were in the 1950s, and they were actually more in a psychological, realm. They were looking at psychoanalytically based theories surrounding autism, and they said that it was a thing called the career-oriented refrigerator mother, which was really in opposition to the women's movement and everything else. Just a ridiculous idea. And then biological explanation sort of supplanted that. But then you had Andrew Wakefield, and Wakefield is the one that actually started pushing this idea about MMR being related to, and later on we found out he was actually sanctioned for it. Had his his medical license revoked. He had a paper in the Lancet about MMR and autism, and very
Which was
faulty,
retracted.
which was retracted, right? And so he was really one of the initial people. But once people get something in their hands, they start to look at it and say, well, here you have a disaffected group. You have a group of attorneys that are going to support them. And then you have this conspiracy theory about the government, about scientists, about medical care. And so then you start moving on to things like thiomersal. And one of the things that they found is that we have tons of mercury in the ocean from industrial waste that are getting into our fish, and we eat that. And when they started looking at thiomersal, they said, well, the rate of autism is still going up, even though people are not using the MMR now. They're not, they're withdrawing from it. So in those populations that withdrew from it, they're still seeing, autism. So this is the thing that, once you have, hard scientific evidence, and it amazes me all the people will say, well, I don't believe in science, but they pick up their cell phone, right, which is based on science, and they use that as a communication, their computers and all that. So it's really a strange kind of situation we're in. But what do you think that people really need to be? Do we need to be more involved now than ever in talking to our legislators, or in making sure that the media is very extremely important, because it's been under attack, of course, and that Mark Zuckerberg and Facebook and with Twitter and all that, they're talking about getting rid of the restrictions on the veracity of the information that's being put into their content, that they want to open that wide, for freedom of speech, so that people can espouse all kinds of theories. It seems like that's a dangerous milieu that we're in right now. If you combine that kind of thinking along with, directives that are not based on science.
It is. It's a hard time to be an expert. It's a hard time to be a journalist. People want to be. People are getting their information from narrower and narrower places, and they're in places where what they have been told is just being confirmed to them over and over and over again, so that when they hear something different, they're disinclined to believe it. And we have people who are, basically, we don't agree as a society on a set of facts anymore. And I don't know how you fix it. I intend to continue to do what I do and try to report on, what it is that I cover and where my expertise is. And I hope that people will believe me. I hope that people won't believe that I have, some hidden agenda. My entire agenda is to help people understand how our health system functions, how the government makes health policy, and how people can be involved in expressing their desires for what policy should or shouldn't be. I mean, that's why I got into journalism. I wanted to help explain things to people.
Mhm. Yeah. Yeah. So, one of the things that also is really kind of important is that, a lot of the things like, Kennedy, even those positions, what I thought was really interesting about your article too, is that these agencies don't operate, in isolation. So they're talking about medical and healthcare issues, NIH, the FDA, and so they're going to have to work together. And I'm not sure of how that's going to complicate the lives of the people in the agency, of trying to get some basic functions done, like assuring drug safety or making sure foods are safe and the vaccines are, approved in a timely manner, even for flu every year. Um, so any thoughts on that about, this intersectionality of, these people who are going to be running these powerful agencies?
Well, of course, we have, overarching all of this, this Doge, the Elon Musk, Vivek Ramaswamy project to try and make the government more efficient, ostensibly by cutting the number of people who work for the government. And I think that has a lot of people, as I say, people who've worked throughout Democratic and Republican administrations, very upset, and many of them looking for the exits, retiring if they're of retirement age, retiring early, going and finding other jobs in the private sector. So there is a lot of concern that there will be a government brain drain from these agencies, and that there won't be the people who will actually carry out these functions that, keep our drugs, get our drugs approved, and keep our food safe, and do our biomedical research.
Well, yeah, that is amazing. And Dr. Arnold is coming right back. But yeah, that's very concerning about the future. And so for how many years you've been making articles?
I started when President Reagan was still in office. So this is it's just starting my 39th year of covering health policy in Washington. I've seen it come and go, and I've seen lots of changes from Republican administrations to Democratic administrations, back to Republican administrations, back to Democratic administrations. But this is the most frontal attack I think I've ever seen on science and expertise in my almost 40 years of doing this.
Yeah, wow. Mhm. But what kind of, do you think that their authority is going to be questioned, internally within the agency, like you were talking about the career employees within these agencies, and they are going to look at them and say, why are you following a directive out externally, even though it's your boss? That is, and I'm sure that was going on in the first administration, where COVID was a big issue, and that was always a big problem. But a lot of career people are at the point where they're saying, I'm close to retirement age, and it's time to go because I don't want to go through this again. And that's going to sort of leave our systems weakened, and we're going to have expertise from some other place, people willing to come in and step into this. And do you think that is something we have to be concerned about?
Yeah, oh, absolutely. We've seen this. I mean, I live in the Washington, D.C. suburbs, so I'm surrounded by people who work at NIH and FDA, and a lot of them are actively looking for other jobs. They've just, they lived through the first Trump administration, which was for many of them not a fun time, and through the COVID pandemic, and they're just, they believe in what they do. Most people who work for the federal government could be making more money in the private sector. They could even be getting better benefits in the private sector. But they believe in the mission. And I think some of them are worried that the mission is going to be undercut. And the question is, who will want to come in and take these jobs? Will there be people to follow them who are also interested in the mission, or will it become a completely different mission? I mean, there are a lot of people now coming to Washington who believe that, the best thing we could do to the federal government is slash it by, a magnitude, some order of magnitude. And there are some that believe that is what Trump got a mandate to do. And maybe they don't know, or they don't care that a lot of them depend on these programs, that someone needs to run. I mean, do they want Medicare and Medicaid to just go away? Do they want FDA to go away? Do they want no one to approve drugs or ensure that food is safe? Do they really think it could be done with 1/10 of the people who do it now? We're going to have to see all those things.
Yeah, and it's really scary because the expertise that is needed is not something you generate overnight. It takes years of dedication. And some of those people have been working there 20, 30, 40 years and know the system inside and out. And there's certain parts of the system you can write it down on paper, but there's certain parts that you have to know. And it's by experience that you learn the system. And but we're running out of time, but I know we're going to have you back again, hopefully with a better stable platform. But I was thinking that this is going to be an issue that's going to be hitting us every month. And I'm looking forward to looking at your articles as you're writing them, because I know you're going to be entrenched in multiple issues that are coming up. You just mentioned some of them tonight, but thank you very, very much for writing this article. It illuminated and taught me a lot about what's I'd like informed on this, especially with the public health side, because that's one of my passions too. So thank you, Julie Rovner.
you.
And we are going to make sure that we see you again. But stay with us. We have another episode coming up, and take care, Julie, and God bless, and the new year.
Thank you.
Mm-hmm.